Gertrude, like he's already introduced me, I'm going to present the Anaemia strategic framework, which is under development right now. So I've just put down here an outline of the strategy. It contains a background with the anemia etiology and the main causes of anemia. It also has a rationale, development process, goal and objective, priority areas. I've highlighted the priority areas because that's what we want our member states to adopt. And we also have a monitoring tool to see how best we can monitor the interventions and path forward. So on the next slide, it's the rationale for the development of the strategic framework. At continental level, we have the Africa Regional Nutrition Strategy. And that strategy has a goal of reducing anemia by 50%. However, it didn't have any sub-strategy to ensure that we address anemia. And also, hearing from the previous speakers, we've noted that there's a stagnation in addressing anemia. Only 17 countries are managing to reach the target of reducing anemia in Africa. And also the Africa Union has a theme every year. And in 2022, we had nutrition as a theme of that year. And in the work plan, there was an activity to ensure that we develop the strategic framework, which is being supported by WHO and Nutrition International. So the process has included a landscape analysis. My colleague Dr. Daniel Romana, will present this landscape analysis result in the afternoon. And we also presented this framework to different experts in different forums for input. It is being guided by WHO, African Union Commission, and Nutrition International. So my colleagues, Lisa and Daniel are here. If there are any questions, we'll be helping each other to respond to those questions. The main goal of the strategic framework is to provide guidance on actions which will help reduce anemia. The ultimate goal is to improve maternal and child health within Africa. The objective is to guide member states to develop action plans. We know that various member states have got anemia strategies already. So we just want them to at least look at how best they can implement anemia interventions by developing an anemia action plan. So that's the main purpose of this framework. So this framework is being guided by a conceptual framework. This one has been adapted from the WHO Global Framework, which Dr. Letitia presented. For Africa, at continental level, our blueprint document is the Agenda 2063. And in this document, we have a goal of healthy and well-nourished citizens, goal number 3 in aspiration 1. And for us to achieve this, we've been implementing the Africa Regional Nutrition Strategy 2026 to 2025. But noting that by next year, the current strategy is ending, we've already initiated the process of developing a new strategy, which starts from 2026 to 2035. So currently, what we are saying is the goal is to achieve 50% reduction of anemia in adolescent girls and women of reproductive age by 2035, taking into consideration the new strategy which is under development. And when you look at the outcomes, it's basically an adoption of what Dr. Letitia presented from the global framework. So we are adopting that one to address the direct causes of anemia. But if you can look in the green area, the big arrow, that's where we want our member states to focus on. So the next slides will be talking about each action area which we want the member states to adopt. For action area 1, we would like basically member states to conduct an analysis of secondary data which is available in country. It could be from DHS or mixed surveys to assess policies as well and monitor how best they can cost anemia programs. So this one is just to emphasize analysis of data for effective decision making. My colleague Daniel will present the continental analysis, which has data for each country. So if countries may wish, they can use that one, or if there's need, they can conduct their own analysis at national and subnational level. The figure there is also just showing the steps which countries can follow. I'm not going to go into detail, but it's just saying if you conduct landscape analysis, you don't find this data, do the next thing. So you can look at that later. Action area 2 is basically addressing the 4 outcomes, the direct causes of anemia, which Dr. Letitia also presented. And each area has got suggested interventions. Here I've just put the main subtopics under each area. For example, we are going to improve micronutrient status. There are issues of dietary diversification, food fortification, supplementation. I think Uganda really did a good job in explaining what's happening in addressing micronutrient deficiency, and also issues of preventing and treating infection and inflammation, more especially malaria, TB, HIV/AIDS, and hookworm infestation. The other third area, we are looking at managing gynecological and obstetric conditions, issues of blood loss during menstruation and delivery. And lastly, we are looking at managing inherited blood disorders, sickle cell anemia. When we look at the statistics in Africa, we think there's no sickle cell anemia, but it's because we are not testing. So it's more encouraging women to test before they get married, and also to test their children when they are born. Action area 3 is more focusing on multi-sectoral integration of interventions. What we are saying here is that the health sector is not the only sector that can address anemia. And we are trying to promote early detection of anemia using different platforms, schools, agriculture sector, and WASH, or, all those other sectors. And also trying to strengthen community health worker programs. For example, we are trying to promote community health workers to also address in-session nutrition actions. So with that, we would need member states to develop at least an integrated M&D framework to ensure that they monitor progress across all sectors. It's more about leadership and governance. There are several actions that we've put under there, 7 of them. Under each action, there are specific interventions, which I'm not going to go into detail. But for example, I'll just go to accountability. Currently, at continental level, we have a nutrition scorecard, which helps to monitor progress in achieving the global targets. In terms of enabling political will, I think you all know we have the King of Lesotho, who is our commissioner's ambassador, who is really helping in advocating nutrition at high level. So, and then there's fundraising. I think you know that we are trying to promote domestic financing for nutrition. For action area 5 is basically a research agenda, and also trying to facilitate sharing of information within member states. In this area, what we are trying to say is action area 1 is looking at secondary data. In this area, if we have resources, we can look at the gaps, data gaps, I think, which we are going to discuss in this meeting, and see how best we can conduct surveys, maybe micronutrient surveys, and also African Union is supporting establishment of an Africa-wide community of practice on anemia. That will be an action after this document is approved. So that's for action area 5. Next slide. In monitoring and evaluation, we have indicators for each area. I know this one is not reader-friendly, but what we are trying to portray here is that we have indicators at impact level, at outcome level, process level, as well as action area level. So for example, at impact level, we are looking at reducing the prevalence, and the indicator is prevalence, anemia prevalence in adolescents and women of reproductive age. This one, mostly we are using hemoglobin assessment to see the prevalence of anemia. For the outcome levels, for improved micronutrient status, we are talking about looking at iron as well as all the other micronutrients. There is a tendency to look only at iron in countries, the HB only. But we are promoting for people to start also assessing vitamin A, vitamin B, you know, all those micronutrients. For infection and inflammation, we have already a framework which is addressing HIV, TB, malaria, and hookworm infestation. So we just adopted those indicators from that framework and linked it with this one. So looking at prevalence of malaria, population with requiring chemo prevention for hookworm, prevalence of HIV, more especially Southern Africa, and then incidence of TB. For reducing gynecological and obstetric conditions, we are talking about preventing PPH and also heavy menstrual bleeding, how many people are on contraception, you know, all that kind of stuff. And then lastly, on screening, I already indicated that we need to start screening for inherited blood disorders in Africa. So we are looking at percentages. So for this level of monitoring, we would like at least all member states to provide data. For process indicators and action area indicators, it will depend on what the member state chooses to implement at that level, depending on the need. So at continental level, I already indicated that we have a continental nutrition accountability scorecard. I've put the link there if you want to access it. What it does is to look at secondary data, DHS, Global Nutrition Report, and portray the process in terms of reaching nutrition targets. It has indicators on WASH, on nutrition, on financing, you know, all those indicators. So if you wish, you can look at it, click on your member state, you see the data there. And basically, we are saying progress is only in 17 countries. We are not trying to shame the countries that are not progressing, but it's for you to look at it and see how best you can improve on what you are implementing. And lastly, in terms of next steps, I've indicated that this document is being developed with WHO and Nutrition International. It has gone through various, you know, meetings for review, and then we are presenting here. If there are comments, we'll still incorporate in the document. Next week, we have our specialized technical committee on health, nutrition, population, and drug control. This meeting brings together ministers of health, nutrition, population, and experts. So the first 3 days we'll have experts to review the document and then recommend to ministers. After ministers endorse it, then we'll present it to the assembly next year in February. After it's endorsed by the Assembly, that's when we can be able to launch the document. So we hope to launch in March 2025. We would normally leverage on existing global meetings. In this case, we are hoping maybe through the Nutrition for Growth Summit, we could launch this document, because our commissioner, the chairperson, and the King of Lesotho will all be there. So we hope to launch the document then. And after launching, because it's basically the heads of states saying, yes, we can go ahead and implement, then we will disseminate in different countries. We know other countries already have a strategy, like we heard from Uganda. We also heard Lesotho has one, but probably financing is a challenge. So this forum will help us to advocate for additional finances for anemia. Thank you so much. If there are questions, my colleagues are here to help. Thank you.